Welcome to the fourth screencast in a series of screencasts on the prevention of food waste in the healthcare sector. I'm Jessica Twemlow, a technical advisor working on behalf of RAP in support of the Hospitality and Food Service Agreement. So far in this series of screencasts, we've looked at why wasting food matters, the size of the issue and the value of food that is wasted, why waste prevention is key to making cost savings, how you can help by promoting food waste prevention and signposting sources of support, where food waste arises, how food waste can be measured and tracked, preventing spoilage in the ward, monitoring the meal ordering system, improving staff communication, reducing plate waste, and protected meal times. In this screencast, I'll be taking you through some good practice to prevent, reuse or recycle waste, especially food waste, in a hospital kitchen. In this screencast, we'll look at the waste hierarchy and where the greatest savings are, opportunities for food waste prevention in the hospital kitchen, including spoilage, menu planning and food service, opportunities for food waste prevention in the hospital restaurant and retail units, opportunities for preventing and managing packaging waste, opportunities for managing food waste, and sustainable procurement. This screencast will last about 15 minutes. I'll begin by briefly recapping on the waste hierarchy. This sets out the main ways of dealing with waste and the order of preference in terms of environmental and financial benefits. Basically, preventing waste in the first place is the most desirable solution for tackling waste. This is followed by preparing for reuse, recycling, other recovery, and finally disposal. Implementing changes that prevent waste should be the starting point, with recycling, recovery and disposal options being considered only where waste cannot be prevented. Prevention is where there is the greatest environmental and financial benefits or savings. But how can you reduce food waste in a hospital kitchen? Well, we'll look at that next. The first step is to prevent spoilage, and the place to start is purchasing. If the catering department order the right amount of the right types of food, then they'll be less likely to waste it, which will save them money. Some tips include establishing good purchasing procedures based on good stock control and forecasting, adjusting regular orders based on accurate historical data in relation to patient numbers and the provision of staff meals, as well as the menu. Using a tool such as a stock control and purchasing list, similar to one on this slide, to keep track of everything. Ensuring good stock management by checking all food deliveries and returning any products that do not meet your expectations. This includes checking the use-by dates and the best before dates to ensure there is sufficient shelf life on them to be used within the timescale planned. These good practice tips will also apply to any retail units in the hospital. The next stage is to look after the food once a hospital has bought it. All food service operations within a hospital, including the main kitchen and any retail units, should store foodstuffs at the right temperatures and check fridge and freezer temperatures regularly to make sure they're correct. Stock rotation should be adhered to, following the basic principle of first in, first out, to ensure that ingredients are used whilst they're still in date. This also ensures there's nothing forgotten lurking at the back of a cupboard or fridge. Where food items have been prepared or cooked, keep a list of what is there and use stickers or other methods of labelling to keep track of where food should be used or thrown away. Strict control of food and storage is essential to prevent misuse of ingredients. An ingredient control system linked to standardized recipes is the most effective method of achieving this. An effective ingredient control system ensures that only the necessary proportion and quantity of ingredients are used from the storage area. Catering department should ensure that standardized recipes are always adjusted for the required number of portions. Further information and advice on the links between food waste prevention and food safety legislation will be available soon through the working groups that have been established as part of the Hospitality and Food Service Agreement. Careful menu planning is next on the list to make sure the right things are ordered and in the right amounts. Plan carefully based on patient forecasts and historical data. Plan menus with patients and patient groups, for example, the elderly. Use perishable items in more than one menu option so they get used up faster. Patient food and food for the hospital restaurant should be based on a similar weekly menu to minimize food waste. Unserved meals from bulk meal system could be sent to a hospital restaurant to be used up. It is important that patient menus are regularly changed for variety and to reflect seasonal variations in the availability of food. Hospitals should operate a minimum 3-week menu cycle if patients frequently stay for long periods of time. However, if the average patient stay is just a few days to a week, then it might be more appropriate to consider moving to a 1-week menu cycle. Hospitals should reduce the time between patients ordering their meal and the receipt of the meal wherever possible. Catering departments should aim to have patients ordering their meals as close to the meal time as possible and no more than 2 meals in advance, including breakfast. Patient meal requests should be reviewed and used to assist in the development of future menus. By carrying out regular patient satisfaction surveys, catering departments can capture patient feedback on the quality and choice of food and the presentation of food. Some hospitals that use a bulk service method experience considerably higher wastage rates because food is served in trays of a set size and they may not use a menu card as food is ordered at the point of service. If the tray contains 8 portions, then 8 portions are produced, even though only 3 may have been ordered. Perhaps an option is to consider introducing smaller serving trays where order numbers are low or dishes are best suited to this. It is important to pre-portion meal components to ensure that the correct portion size is given. For solid food like macaroni cheese and meat pies, the contents of the tray should be pre-proportioned in the main kitchen. For less popular food, a small number of portions may be ordered by a ward. Often bulk containers are filled to the same level even though the number of portions required by the wards can vary significantly. Consider providing the correct number of portions by either noting the volume of the bulk container that a set number of portions should occupy, or note the weight that a set number of portions would represent. A high level of wastage is often observed for food provided in bulk containers, such as porridge and soup. These foods are often provided in bulk, even if a plated food system is used within the hospital. Plates of bread are often automatically provided to patients during meals, often generating large quantities of uneaten bread. Consider providing bread on request, either from the ward kitchen or as a separate request on the menu. For some hospitals, restaurants and retail units can be a significant source of food waste. Important things to concentrate on include the fact that counter food can be a significant source of food waste. To reduce this waste, the hospital restaurant could set out less food at the start of the food service and replenish the counter more often throughout the meal service. Try to avoid preparing food too close to the end of service. Staff and visitors should be encouraged to purchase what is already prepared and available. In particular, consider cooking smaller batches of sides, such as rice and chips, towards the end of the service. And apply good portion control by working out optimum portion sizes and keeping to them using standard ladles and measuring cups or by weighing. The next area for hospitals to reduce waste is to target packaging waste. Some key opportunities might include using returnable and reusable transit packaging where appropriate, such as for fruit and vegetables. Redesigning staff takeaway packaging to make storage easier, protect food better, and minimize waste. Minimize double wrapping of food, whether it's food being delivered or takeaways. Using catering packs, which can result in less packaging per unit of product, but only if this is not going to create food waste because products are not used before it goes out of date. And standardizing packaging as far as possible so it's easier to manage and store. Effective waste management relies on good segregation, and the main ways that hospitals can improve the segregation of material for reuse, recycling and disposal include setting up easy-to-use internal collection systems to recycle as many waste streams as possible. Clearly define who is responsible for doing what, for example, emptying the bins. Defining collection points or bins, and colour coding and labelling bins so it's obvious even to a visitor what waste goes where. Train staff so they know what the different bins are for and how to use them properly. And monitor how much is recycled and how much less is thrown away. It's important the results are reported back to staff so they can see the results of their efforts. Most hospital sites will benefit from a mixed dry recycling system. Some ways to increase recycling include getting the bins right. Incorrect types and number of bins can lead to the wrong waste going into the wrong bin, such as recycling going in with general waste. Adjusting the size of bins or the frequency they're collected can also save money. Ask your waste management contractor for your data. Having data on how much waste is going to landfill or being recycled is important as it will help you understand your current levels of recycling. This information can then be used to further identify opportunities and whether there are sufficient quantities for separate collection of other materials. Monitoring how this changes on a regular basis will help you see improvements that you've made. You may wish to consider dealing with your unavoidable food waste by moving from food waste disposal via macerators or the domestic waste stream to a segregated food waste collection system or on-site treatment and disposal. Water companies advise that macerators place an extra load on our aging sewerage systems. This can lead to the build-up of layers of fatty deposits on the inside of sewer pipes, reducing their water carrying capability, which is imperative during heavy storms. Maceration also does not represent the best environmental option. They use large volumes of drinking water at a time when reducing water wastage is a priority for many hospitals. If food waste is collected separately and sent for appropriate treatment, it can be turned into valuable end products such as compost or can produce renewable energy. Possible methods of on-site pre-treatment include holding tank systems. This is where food is transported through a pipe network from the kitchen to a remotely sited sealed storage tank. The food waste can then be collected by a waste management company and can be sent for treatment. Dewatering systems. The process of dewatering can reduce the overall volume of food waste by up to 80%, lessening the need for large storage areas. The food is transported to the dewatering equipment via a pipe network, and the remaining solid dehydrated food waste can be sent for treatment. And drying systems. This is where heat is applied to the food waste to evaporate the water. This is condensed and sent to the sewer, and the remaining solid dehydrated food waste can be sent for treatment. Segregated food waste collection systems may be more cost-effective for small healthcare facilities, whereas dewatering, holding tank or drying systems may be more cost-effective for medium and large healthcare facilities. It's worth highlighting the basic rules for on-site composting and anaerobic digestion. There is a guidance document on our website which can be found at the web address shown on the slide. The Waste Scotland Regulations 2012 require that Scottish healthcare facilities present their food waste for separate collection from the 1st of January 2016. Under the regulations, macerators cannot be used to discharge food waste to a drain or sewer. Systems like enzymic digesters that do not recover any organic waste prior to it going to sewer are also banned under the regulations. There are currently no plans to prohibit the use of macerators or enzymic digesters in England or Wales. Sustainable procurement embeds environmental, economic and social criteria into contractual documents with the aim of motivating suppliers to offer more sustainable products and services. Working with current and future suppliers can help you reduce food waste through sustainable procurement opportunities. RAP has developed a facilities management procurement toolkit to provide information, guidance and templates to assist organisations with improvements to the resource efficiency of catering services. This includes model procurement wording for tenders, specifications and clauses. The government buying standards are easy-to-use product specifications to enable the public sector to procure sustainably. The government buying standards for food and catering services were introduced in 2011 and are considered best practice for the NHS. They include a suite of criteria covering 3 areas of sustainable procurement. Area 1 looks at food produced to a higher sustainability standards, where food is produced to higher environmental standards such as seasonal fresh food and ethical trading considerations. Area 2 is where food is procured and served to higher nutritional standards, to reduce salt, saturated fat and sugar, and increase consumption of fibre, fish, fruit and vegetables. And Area 3, procurement of catering operations to higher sustainability standards, including equipment, waste and energy management. Before I bring this screencast to a close, I just want to provide you with a few web links to some of the free online support and advice that you can find on our website. These online resources can help food service operators to identify quick and easy ways of cutting down on food waste costs. The Online Resource Centre offers some simple top tips to cut waste within the operations of a typical kitchen. The Hospitality and Food Service Info Finder holds a wealth of practical and proven advice and supporting guidance. Essentially, it's a search and find tool which allows different types of food service operators to find the information most relevant to them. So whether a hospital caterer wants to learn some more about sustainable procurement, or a restaurant wants to see what others are doing, this is the place to look. And if a food service operator is thinking about recycling food waste, we've got the Food Waste Recycling website with information, advice and tools to help them make it work. Well, that brings us to a close for Screencast 4. I'll recap on what we've covered during this session. We've looked at ways to prevent food waste in the hospital kitchen, looking at preventing spoilage, effective menu planning, and reducing waste through food service in the hospital restaurant and retail outlets. We've also looked at reducing packaging waste, segregating waste and developing workplace recycling schemes, and sustainable procurement. If you've not already done so, please take a look at the other screencasts in this series, as this will provide you with advice and tools to help you reduce food waste and cut costs. And don't forget, any NHS trust or private healthcare provider can sign up to the Hospitality and Food Service Agreement. Thank you for listening. Please don't hesitate to get in touch by emailing hafs@rap.org.uk if you'd like to find out more. Goodbye for now.